Hello sa mga sawi sa pag-ibig, those who are currently in a relationship, and those who are satisfied with the current relationship status. We are in a very interesting topic today, that part of your body that decides the wants instead of the needs, the one that aches when you get left behind, and makes you feel warmth when you are overjoyed. But I hate to burst your bubble, although I said all those things, they are really not the physiologic function of the heart. Welcome to the discussion of the heart, esophagus, and the thymus. My name is Doc Klein. Let's begin. Joke lang, dili pa day heart ang una. So naa pa day skin. So the skin is called the pericardium. Where have I heard this before? Yes, during the discussion of the mediastinum. Remember? So the pericardium is a fibroserous sac that encloses the heart and roots of the great vessels. Its function is to restrict excessive movement of the heart as a whole and to serve as a lubricated container in which the different parts of the heart can contract. The pericardium also lies within the middle mediastinum, posterior to the body of the sternum, and second to the sixth costal cartilages and anterior to the fifth to the eighth thoracic vertebra. Alright, so your pericardium has two parts. You have the fibrous pericardium and the serous pericardium. So the fibrous pericardium is a strong fibrous part of the sac. It is firmly attached below to the central tendon of the diaphragm. It fuses with the outer coats of the great vessels or blood vessels passing through it, namely the aorta, the pulmonary trunk, the superior and inferior vena cava, and the pulmonary veins. The fibrous pericardium is attached in front to the sternum by the sternopericardial ligaments. So for the serous pericardium, the serous pericardium lines the fibrous pericardium and coats the heart. It is divided into parietal and visceral layers. The parietal layer lines the fibrous pericardium and is reflected from the roots of the great vessels to become continuous with the visceral layer of the serous pericardium that closely covers the heart. The visceral layer, on the other hand, is closely applied to the heart and is often called the epicardium. So here, this one here. Okay, so the slit-like space between the parietal and the visceral layer here is the pericardial cavity. And normally the cavity contains a small amount of tissue fluid, about 50 ml, that's 50 ml, in the pericardial fluid, which acts as a lubricant to facilitate movement of the heart. So similarly, they function the same with the lungs. Right, so your pericardial sinuses there are two. So on the posterior surfaces of the heart, the reflection of the serous pericardium around the large veins from a recess called the oblique sinus. Also on the posterior of the heart is the transverse sinus, which is a short passage that lies between the reflection of the serous pericardium around the aorta and pulmonary trunk and the reflection around the large veins. The pericardial sinus form as a consequence of the way the heart bends during development. So they have no clinical significance actually. So taas kaayo kung gistorya nun niya, wala rin siya clinical significance. So kalimti na lang ninyo guys. Just joking. Alright, so for the nerve supply of the pericardium, the fibrous pericardium and the parietal layer of the serous pericardium are supplied by the phrenic nerve. So the visceral layer of the serous pericardium is innervated by branches of the sympathetic trunk and the vagus nerves. So you will know more about this one when we reach into neuroanatomy. So actually, if you think about it, the phrenic nerve is a branch of the vagus nerve. Alright, so, huwag nyo skip, tiisin nyo lang guys, makaka-move on rin kayo. Kani heart na gyud. So the heart is a hollow muscular organ that is somewhat pyramid shaped and lies within the pericardium in the mediastinum. It is connected at its base to the great blood vessels, but otherwise lies free within the pericardium. Alright, so we'll discuss the surfaces of the heart. May pangit pero mabuti. Tapos yung isa maganda pero galing ahas naman. Tapos may pangit na ugaling ahas. Dok, ano ba? Oo na, sige. So the heart has three surfaces. So you have the sternocostal or the anterior part here. Okay, yung nakikita ng iba. So diaphragmatic is the other one here, which is known also as inferior. Oops, no touch. And the base or the posterior part here at the back. So yung ayaw ipakita. So it also has an apex here, yung madaling kausap, which is directed downward, forward, and to the left. So this is here. So it is directed downward here, forward, and to the left side. Alright. Sige, serious na. Isa-isahin natin yung surfaces. So, the sternocostal surface or the anterior surface is formed by or mainly by the right atrium and the right ventricle, which are separated from each other by the vertical atrioventricular groove. This one here. So, the right border is formed by the right atrium and the left border by the left ventricle. Right atrium, left ventricle, and the part of the left auricle here. Okay, so the right ventricle is separated from the left ventricle by the atrio or anterior intraventricular groove. So this one here. Okay, so this is the right ventricle and this is the left ventricle. All right, so the diaphragmatic surface of the heart is formed mainly by the right and the left ventricle separated by the posterior interventricular groove. The inferior surface of the right atrium into which the inferior vena cava opens also forms part of the surface. The base of the heart are also known as the posterior surface is formed mainly by the left atrium here into which opens four pulmonary veins. This one. Okay, so the base of the heart lies opposite to the apex. So this is the base, this is the apex. Okay, so the apex of the heart formed by the left ventricle is directed downward, forward, and to the left again, and it lies as the level of the fifth left intercostal space, around 3 to 5 inches or 9 centimeters from the midline. So in the region of the apex beat can usually be heard or palpated in the living patient. So that's where it is. Okay. So note that the base of the heart is called the base because the heart is pyramid shaped. The base lies opposite to the apex, and the heart does not rest on its base. It rests on the diaphragmatic surface or the inferior surface. Okay. That's just a clarification. Alright, so just like your lungs, you also have grooves in your heart. So here you have what grooves are here? So you have the anterior interventricular groove filled with fat, that's why it's yellow. And you also have the atrioventricular groove, which separates the atrium and the ventricles from this side. Alright, so once again, the right border is formed by the right atrium, the left border is by the left auricle, and below is by the left ventricle. The lower border is formed mainly by the right ventricle, but also by the right atrium, so as you can see here. Now the apex is formed by the left ventricle alone. So the heart is divided by a vertical septa into 4 chambers. So here you have the right atrium, the left atrium, the right ventricle, and the left ventricle. The right atrium lies anterior to the left atrium, and the right ventricle lies anterior to the left ventricle. So the heart actually doesn't exist like this, but it's more of a ball. All right. So the walls of the heart are composed of the cardiac muscle known as the myocardium, covered externally by the serous pericardium, the epicardium, and internally with the layer of endothelium, the endocardium. Alright, so let's discuss first the right atrium. We have here the right auricle. So this is a conical muscular pouch of the upper anterior portion of the right atrium, which covers the first part of the right coronary artery. The sinus venarum, or also known as the sinus venarum cavarum, is a posteriorly situated, smooth-walled area that is separated from the more muscular atrium proper by the crista terminalis. So the crista terminalis develops from the embryonic sinus venosus and receives the superior vena cava, inferior vena cava, the coronary sinus, and the anterior cardiac veins. Next is the pectinate muscles. So these are prominent ridges of the atrial myocardium located in the interior of both auricles and the right atrium. While the crista terminalis, found here, is a vertical ridge or muscular ridge running anteriorly along the right atrial wall from the opening of the superior vena cava to the opening of the inferior vena cava. So this provides the origin of the pectinate muscles. It represents the junctions between the primitive sinus venarum, a smooth wall-shaped region I mentioned a while ago, and the right atrium proper over here, and is indicated externally by the sulcus terminalis. So a veni cordis minimi are actually the smallest cardiac veins, which begin in the substance of the heart. So this actually is found in the endocardium and the innermost layer of the myocardium, and chiefly in the atria at the foramen venarum. Alright, so fossa ovalis, what else? Fossa ovalis is this one. So it is an oval-shaped depression in the interatrial septum. This is the septum, right, and represents the site of the foramen ovale, through which blood runs from the right atrium to the left atrium before birth. The upper rounded margin of the fossa is called the limbus fossa ovale. This one here. Alright. So the sulcus terminalis is also a groove on the external surface of the atrium, which marks the junctions of the primitive sinus venosus with the atrium in the embryo and corresponds to a ridge of the internal heart surface, the crista terminalis. The coronary sulcus is a groove on the external, on the external surface of the heart and marks the division between the atria and the ventricles. The crux is the point at which the interventricular and the interatrial sulci cross the coronary sulcus. So the left atrium is actually smaller and has thicker walls than the right atrium, but its walls are smooth except for a few pectinate muscles in the auricle. It is the most posterior of the four chambers, lying posterior to the right atrium, but anterior to the esophagus, and shows no structural borders on the posterior anterior radiograph. It receives oxygenated blood through the four pulmonary veins. Alright, so for the right ventricle, this makes up the major portion of the anterior sternocostal surface of the heart, and it contains the following structures. You have the trabeculae carneae, which is here. This is the major one. So this is the full name is trabeculae carneae cordis, and these are anastomosing muscular ridges of the myocardium in the ventricles. The papillary muscles here are cone-shaped muscles enveloped by the endocardium, and extends from the anterior and posterior ventricular walls in the septum, and their apices are attached to the chordae tendineae, this one here. Okay, so this contracts to tighten the chordae tendineae, preventing the cusps of the tricuspid valve from being everted into the atrium by the pressure developed by pumping action of the heart. This prevents regurgitation of the ventricular blood into the right atrium. Okay, so next up we have the chordae tendineae. So it extends from one papillary muscle to more than one cusp of tricuspid valve. So it prevents eversion, once again, of the valve cusps into the atrium during ventricular contractions. So next we have the conus arteriosus, or the infundibulum. This is an upper smooth-walled portion of the right ventricle which leads to the pulmonary trunk. Next up is the septomarginal trabecula here. This is known as the moderator band. So this is an isolated band of the trabeculae carneae that forms a bridge between the IV, or the intraventricular septum, and the base of the anterior papillary muscle of the anterior wall of the right ventricle. So this is called a moderator band for its ability to prevent over-distension of the ventricle, and carries the right limb, or the Purkinje fibers, of the AV bundle, or atrioventricular bundle, from the septum to the sternocostal walls of the ventricle. So lastly, we have the IV septum, or the intraventricular septum. So this is a place of origin of the septal papillary muscles, and is mostly muscular but has a small membranous upper part, which is a common site for VSDs, or ventricular septal defects of the atrium, wherein there is a hole in between the ventricular wall, okay, in the septum, which connects the right ventricle to the left ventricle. The left atrium lies at the back of the heart, and its apex is directed downward, forward, and left. It is divided into the left ventricle proper and the aortic vestibule, which is the upper anterior part of the left ventricle and leads into the aorta. It contains two papillary muscles, alright, anterior and posterior, with their chorda tendineae and the meshwork of muscular ridges, the trabecular carneae cordis. So it performs harder work and has a thicker, 2 or 3 times as thick walls than the right atrium, and is no longer narrow and more conical in shape than the right ventricle. Alright, so these are the heart valves. So we have the tricuspid valve, the mitral valve, which are known as the atrioventricular valves, and we also have the aortic valve and the pulmonary valve here, which are also known as your semilunar valves. Alright, so we'll first discuss the pulmonary valves. So these lies behind the medial end of the left third costal cartilage and adjoining part of the sternum. It is most audible over the left second costal space, just lateral to the sternum, and is opened by ventricular systole and shut slightly after closure of the aortic valve. Alright, so the aortic valve lies behind the left part of the sternum and opposite to the third intercostal space. Is closed during ventricular diastole, and its closure at the beginning of the ventricular diastole causes the second dub heart sound. So is most audible over the right second intercostal space, just lateral to the sternum. So this here is actually the anatomical position of the heart valve, while this one is the auscultatory, which means you will be using your stethoscopes to hear the sounds. Alright, so we have here the next valve. We have the tricuspid valve here. So it lies between the right atrium and the right ventricle, behind the right half of the sternum opposite to the fourth intercostal space, and is covered by endocardium. It is most audible over the right or the left side of some people, in the lower part of the body of the sternum. It has an anterior, posterior, and septal cusps, which are attached by the chorda tendineae to 3 papillary muscles that keep the valve closed against the pressure developed by the pumping action of the heart. So it is closed during the ventricular systole, or that is contraction when you say systole, and its closure contributes to the first lub dub or lub heart sound. The bicuspid valve here, or also known as the left AV valve, it's called the mitral valve because it's shaped like a bishop's mitre. So lies between the left atrium and the left ventricle, behind the left half of the sternum at the fourth costal cartilage, and has 2 cusps. Okay, so a large anterior and a smaller posterior. Is closed slightly before the tricuspid valve by the ventricular contraction, which is systole, and its closure at the onset of the ventricular systole causes the first lub or heart sound. It is most audible over the apical region of the heart in the left fifth intercostal space at the midclavicular line. So once again, the first heart sound or the lub is caused by the closure of the tricuspid and the mitral valve at the onset of ventricular systole, while the second dub or sound is caused by the closure of the aortic and pulmonary valves and vibration of the walls of the heart and major vessels at the onset of ventricular diastole. Kaya pa? So here's a meme about a brain versus the heart. This is from awkwardyeti.com. So shameless plugin. I really enjoy short graphics like short comics like this one. Alright, so we go to the conducting system of the heart. It is composed of a modified specialized cardiac muscle cells that lie immediately beneath the endocardium and carry impulses to the cardiac muscles, signaling the heart chambers to contract in a proper sequence. Alright, so some things to remember. We have conducting system of the heart, the sinoatrial node. Once again, it's a small mass of specialized cardiac muscle fibers that lie in the myocardium at the upper end of the crista terminalis near the opening of the superior vena cava in the right atrium. It is known as the pacemaker of the heart and is supplied by the sinus node artery, which is the branch of the right coronary artery. So the AV bundle or the bundle of His begins at the AV node and runs along the membranous part of the interventricular septum. It splits into the right and left branches, which descends into the muscular part of the interventricular septum and breaks up into terminal conducting fibers known as the Purkinje fibers to spread out into the ventricular walls. Sumuan na siya. Right. So once again, the AV node lies in the interatrial septum, superior and medial to the opening of the coronary sinus in the right atrium, and it receives the impulse from the sinoatrial node and passes it to the AV bundle. So try to remember the video, so it's actually there. So it is supplied by the AV nodal artery, which usually arises from the right coronary artery, opposite to the origin of the posterior interventricular artery. It is innervated by autonomic nerve fibers, although the cardiac muscle fibers lack motor endings. Alright, so we go to the coronary arteries. These arises from the ascending aorta and are filled with blood during ventricular diastole or during relaxation of the heart. They have a maximal blood flow during diastole and a minimal blood flow during systole because of compression of the arterial branches in the myocardium during systole.
With
So the right coronary artery arises from the anterior or the right aortic sinus of the ascending aorta, which runs between the root of the pulmonary trunk and the right auricle, and then descends into the right coronary sulcus and generally supplies the right atrium and the ventricle. So these are the following uh, branches of the right coronary artery. So try to look at the video once again and see if they are there. Okay, so next we have the left coronary artery. So it arises from the left aortic sinus of the ascending aorta just above the aortic semilunar valve, is short than the right coronary artery, and usually is distributed to more of the myocardium. So it gives rise to the anterior IV artery and also the circumflex artery. IV is once again arterial septum or interventricular septum, sorry. Alright, so next we have the cardiac veins in the coronary sinus. So the coronary sinus is the largest vein draining the heart and lies in the coronary sulcus. So because it's a large vein, it lies in a huge place. So that's why there's a sulcus, which separates the atria from the ventricles. So it opens into the right atrium between the opening of the IVC and the AV opening. It has one cusp valve at the right margin of its aperture and receives the great middle and small cardiac veins, the oblique vein of the left atrium, and the posterior vein of the left ventricle. So try to think of the video when you're reading this part, because these are actually important things. So you have the great cardiac vein, which begins at the apex of the heart and ascends along the IV branch of the left coronary artery. It turns to the left to lie in the coronary sulcus and continues to as the coronary sinus. So you also have 5 more. So I'll leave the reading up to you. Try to see the video once again and try to correlate this one with the video itself. Alright? So we have the lymphatic vessels of the heart. So receives lymph from the myocardium and the epicardium and follows the right coronary artery to empty into the anterior mediastinal nodes and follow the left coronary artery to empty into the tracheobronchial node. So you'll see this one later on. These are just things that you have to remember. For the cardiac plexus, it receives the superior, middle, and inferior cervical and thoracic cardiac nerves from the sympathetic trunks and vagus nerve. So it richly innervates the conducting system of the heart. The right sympathetic and parasympathetic branches terminate chiefly into the region of the SA node, and the left branches end chiefly in the region of the AV node. The cardiac muscle fibers are devoid of motor endings and are activated by the conducting system. Alright, so we have another one here. So I know it's actually a bit hard on you guys, but try to look at the videos, the supplementary videos that I'm going to post. I know it's really going to be hard, and actually discussing the whole thing is also difficult for me, but I hope you're understanding what I'm saying. All right. So next we have the great vessels. All right. So one of the first great vessel is the ascending aorta, and it takes its origin from the left ventricle within the pericardial sac and ascends behind the sternum to end at the level of the sternal angle. So it lies in the middle mediastinum and has 3 aortic sinuses located immediately above the cusps of the aortic valves and gives off the right and the left coronary artery. The aortic arc, on the other hand, is just continuation of the ascending aorta. It is found within the superior mediastinum and begins as a continuation of the ascending aorta, and the arches over the right pulmonary artery and the left main bronchus. So it forms a prominence that is visible on the radiograph as the aortic knob. So it's actually a circular portion, and it gives rise to the brachiocephalic artery, the left common carotid artery, and the left subclavian arteries. Okay, and then it continues down to the descending aorta, going to the abdomen. So the superior vena cava is formed by the union of the right and left brachiocephalic veins and returns the blood from all the structures superior to the diaphragm, except the lungs and the heart. Descends on the right side of the ascending aorta and receives the zygous veins and enter the right atrium. Its upper half is in the superior mediastinum, and its lower half is in the middle, or the middle mediastinum. The pulmonary trunk. The pulmonary trunk here arises from the conus arteriosus of the right ventricle here, and passes obliquely upward and backward across the origin of the left side of the ascending aorta within the fibrous pericardium. So, and bifurcates into the right and the left pulmonary arteries in the concavity of the aortic arc. So it goes inside, or it passes through the aortic arc along with the main bronchus here. So the right pulmonary artery runs into the right behind the ascending aorta here and the superior vena cava to enter the root of the right lung. Okay, the left pulmonary artery runs to the left in front of the ascending aorta to enter the root of the left lung. So the ligamentum arteriosum here is a fibrous band that connects the bifurcation of the pulmonary trunk to the lower concave surface of the aortic arc. And the ligamentum arteriosum is actually a remnant of the ductus arteriosus, which is in the fetus conducts blood from the pulmonary trunk to the aorta, thus bypassing the blood or the lungs. And because at that time the lungs are not functioning because the baby's still inside the womb, right? So it has to have the blood, the oxygenated blood going to the baby is coming from the mother. Right. So the left recurrent laryngeal nerve hooks around the lower border of the structure of this structure. All right. So after birth, the ductus closes, and should it remain patent, that's why they call it patent ductus arteriosus. And the aortic blood will actually enter the pulmonary circulation from here to here, producing pulmonary hypertension. There will be increased pressure inside the lungs, and hypertrophy of the right ventricle will also occur. So usually, surgical ligation of the ductus is also necessary, or just given NSAIDs or your medications in order for it to close, if it's small.
So what you're looking at is one of the most amazing
All right, so we have the lymph nodes of the thoracic wall. So the lymph vessels of the skin of the anterior thoracic wall drains into the anterior axillary nodes, and the lymph vessels of the skin of the posterior thoracic wall drains to the posterior axillary nodes. The deep lymph vessels of the anterior parts of the intercostal spaces drain into the internal thoracic nodes, along with the internal thoracic blood vessels. So from here, the lymph vessels to the thoracic duct on the left side and the bronchomediastinal trunk on the right side. So the deep lymph vessels of the posterior part of the intercostal spaces drain backward into the posterior intercostal nodes lying near the head of the rib. From here, the lymph node enters the thoracic duct. For the mediastinum, in addition to the nodes draining the lungs, other nodes are found scattered through the mediastinum. They drain lymph from the mediastinal structures and empty into the bronchomediastinal trunk and the thoracic duct. For the nerves of the trunk, it consists of sympathetic or thoracolumbar outflow and parasympathetic or the craniosacral outflow systems. So you also have the vagus nerve and the left recurrent laryngeal nerve. There's just a branch. All right, so it's not over yet, so try to get up. The heart says I will. Just give me like 5 minutes. Okay, you may take a break and then just come back after. Right, so we go to the esophagus. The esophagus is actually a tubular structure about 10 inches or 25 centimeters long that is continuous above with the laryngeal part of the pharynx opposite to the sixth vertebral or cervical vertebra. Sorry. It passes through the diaphragm at the level of the 10th thoracic vertebra to join the stomach. And in the thorax, it actually passes downward and to the left through the superior and then posterior mediastinum. At the level of the sternal angle, the aortic arc pushes the esophagus over the midline, as you can see here. All right, so these are the relations of the thoracic part of the esophagus from downward are as follows. So anteriorly, they have the trachea or the trachea here. So this is the esophagus, the green one, the green tube. And then you have here the trachea. You also have here the left recurrent laryngeal nerve. You also have the left principal bronchus, which constricts it, and the pericardium, which separates the esophagus from the left atrium. Posteriorly, at the back of this is the body of the thoracic vertebra, and the thoracic duct, the zygous veins, the right posterior and intercostal arteries, and its lower end, and the descending thoracic aorta. Once again, I admit this is not actually a very good picture to watch, but if you try to look at the Google photos of the relations of the esophagus, you will see it clearly. So we have right side, the mediastinal pleura and the terminal part of the zygous veins, and the left side is the subclavian artery, the aortic arc, and the thoracic duct, and also the mediastinal pleura. Right, so the blood supply includes the upper third of the esophagus is usually supplied by the inferior thyroid artery, and the middle third by the branches of the ascending thoracic aorta, and the lower third by the branches from the left gastric artery. So just note, the inferior thyroid artery comes from the neck, the middle third by the branches from the descending thoracic aorta, and the lower third by the branches from the left gastric artery are actually found in the stomach already. So the veins from the upper third drains into the inferior thyroid vein. So the same as the artery, you just have to change the name from artery to vein. From the middle third into the azygous veins, and from the lower third into the left gastric vein, a tributary of the portal vein. So the lymph drainage of the esophagus um, actually, the lymph vessels from the upper third of the esophagus drains into the deep cervical nodes from the middle third into the superior and posterior mediastinal nodes, and from the lower third into the nodes along the left gastric blood vessels in the celiac nodes. So the esophagus is actually supplied by the parasympathetic and the sympathetic efferent and afferent fibers via the vagus nerve and the sympathetic trunks. So in the lower part of its thoracic course, the esophagus is surrounded by the esophageal nerve plexus. All right, so one more. I just don't understand it. We just got our paycheck. How are we out of money already? So I know it's really hard, guys. Try to uh, bear with me. Thank you. So lastly, we have the thymus. So the thymus is actually a flattened bilobe structure, so lying between the sternum and the pericardium in the anterior mediastinum. In the newborn infant, it reaches its largest size relative to the size of a body, at which time it may extend up through the superior mediastinum in front of the great vessels into the root of the neck. So the thymus continues to grow until the puberty, but thereafter undergoes involution or mawala siya. No? So it has a pink lobulated appearance, and it is the site of development of the thymic lymphocytes or the T lymphocytes. So I think you'll learn more about it later on in physiology. Alright, so a heart gives 2 billion beats in a lifetime. Now, anyone studying a heart can hold it in their hands because it actually looks the same and it has the same shape and size as your fist. So, and make it pump for real and watch the action unfold. So place your hand above your own heart and feel its rhythmic beat. Understanding this inner dependable pump works gives new resonance to the feeling you get when you run a race, drink too much caffeine, or watch the eye of the one you love. Thank you.